Good morning, good afternoon, everybody. I'm glad to be invited for this international conference on occupational surveillance and environmental health. So I'm going to present my research under the topic One Health, Sustainable Ecosystem and the Environment. So my title is Antimicrobial Resistance Profile of E. coli Isolated from Hospital and Industrially Polluted Wastewater Systems. So before I dive into my presentation, I want to highlight my academic history. In 2014, I joined Walkitta University and I graduated in 2018 with BSc in biotechnology. And in 2019, I joined Dambidollо University as assistant lecturer and I've been teaching undergraduate biotechnology students up to 2020 with this position. And since 2021 up to 2023, I served as Elsevier country ambassador in collaboration with different scholars across different parts of Africa, where we have been delivering training workshops and building networks among higher educational institutions in Africa with the Elsevier Journal publisher, and we trained more than 3,000 young researchers on grant writing, publishing, and post-publication tracking systems using Elsevier research tools. And then in 2021, the same year, where I started this position, I joined Addis Ababa University to specialize in healthy biotechnology with a research focus on antimicrobial resistance via the One Health perspective or approach. Then I graduated in 2023, and I go back. I went back to Dambidolllo University, and I've been serving as a lecturer and researcher. And currently, I'm based in South Africa, Stellenbosch University, particularly in the SETI Center for Epidemic Response and Innovation, as African Stars Fellowship. When you come back to my research, so the global rise of antimicrobial resistance is being the global public health burden, and this is disproportionately affecting low resource setting countries, including Ethiopia. The data in 2019 revealed that AMR bacteria were directly attributable to 1.27 million diseases directly, and it is associated with about 5 million diseases globally. So there are different systems which are contributing for AMR gene emergence and spread. This includes human, animal, and hospital sewage, industrial sewage, as well as the radiation, which collectively runs to environment where microorganisms can exchange the resistance genes just to survive in the environment. So in this environment, we have a people, animal, and plants, as well as these microorganisms where these resistance genes can run from one organism to another through different reservoirs. So the reason for this one is just the weak One Health implementation, particularly in resource-limited settings, including the country where this research was conducted. Yeah, so these are the main vehicles affecting antimicrobial resistance flow in the environment. The sewage that runs from households and effluents from healthcare facilities, especially untreated sewage, as well from animal production companies and pharmaceutical industry wastes, which are very contributors for the AMR as well. Yeah, wastes from crop production, which may pose resistance development. So some factors for the AMR emergence are lack of awareness, absence of rapid and efficient diagnostic facilities, particularly in developing countries, and low economic status, poor regulatory framework is, which includes One Health approach implementation. The objective of this study was to evaluate the AMR profile of E. coli isolated from hospital sewage and industrially polluted rivers in Adama and Dukam respectively. And the specific objectives were just to assess the AMR patterns in Escherichia coli and to identify the genetic determinants of the AMR, specifically TEP A and blood TEM, and then to evaluate the public implementations or implications of the findings or profiling of this AMR. These are the study area. The study area was located in Oromia near Addis Ababa. So yeah, this is Oromia. So it is was located around here. This one is a hospital samples, and this is yeah, the industrially polluted samples were collected from this site. So this is a general workflow for the study. I collected samples from polluted rivers, as well from the Adama Hospital Medical College, then transported to Addis Ababa University Institute of Biotechnology Molecular Biotech Lab. Then isolation and identification was conducted using biochemical characterizations of the isolate. Then antimicrobial susceptibility test was conducted using the disk diffusion method. So these confirmed AMR genes were revealed using specific primers just by running a PCR. Then data was analyzed using the SPSS version 26. Here are some images from the results. This one was yeah, it is metallic green fizz color, which is distinctive color for E. coli on Eogeum methylene blue overnight culture. This pink was the color of E. coli on the McConkey agar, and this one is on nutrient agar. So these were the a number of biochemical tests which used for isolation and identification of these microorganisms. So a total of 75 isolates were confirmed as presumptive E. coli, and these were the specific antibiotics which were tested for this study. So from this disk diffusion method, 15 isolates were confirmed, subjected for ASC test. And here is the general, resistance, susceptible, and resistant isolates among the 11 antimicrobials. So here we can look at this 76, which is erythromycin, which is lower compared to 97 result of the study conducted by this guy in 2022. And 72 equal tetracycline and vancomycin. Tetracycline is greater than this, the report which was conducted by Valletta et al. In Bahar Dar in 2022. And the other one is 16 for streptomycin, which is higher than the report in Philippines by Dila et al. In 2020 as well. So when we look at this, this is a resistance profile among the 11 antimicrobials, intermediates, and susceptible. So just we can observe that erythromycin is this one. It is a very high, while this and this are tetramycin and vancomycin respectively. And the least one is norfloxacin, which is toward this, most of the isolates were susceptible to that and ciprofloxacin as well. So this one is also ampicillin, and streptomycin is here, which takes place on the pores. And the cross-tabulation of sample growth with the AMR pattern is among the three hospital wards: ICU, OPD, and IPD. And there were three different water samples: Yarra River after the industrial waste, and Yarra River before the industrial waste discharge. And this one is the Dacha River, which is a bit away from the industrial sites. So we checked this resistance. The resistance was high for open patient department in case of the hospital wards, and 66 for that of the river site, which is polluted with the industrial wastes. So these are the significance level. So it depicted that, for those hospital wards, there is no a significant difference, but there is a significant difference for the Yarra River and the other control rivers. This is ANOVA between groups and within groups. Between groups, it is significant. There is a significant difference between the sites. So this indicates results from analysis of variance conducted just by comparing AMR patterns. So statistical significance confirmed as a difference. The study size. And totally 45 of the 15 isolates were multi-antimicrobial resistance, which is very higher compared to the one reported by Kit in Tanzania. So these variations may account or contribute to due to different reasons, including sampling techniques, evolution of the microorganisms, culturing techniques, as well as environmental conditions may affect for this variation. This is another illustration per each sample sites. This is for ICU, IPD, OPD, and this one is industrially polluted river sample, which is the second level next to the OPD. This one is a multi-drug resistance index, which indicates whether the microorganisms or isolates are among the risk-causing groups or not. So among the 15 tested isolates, only these 4 were not included as a multi-drug resistance index, which can cause risky groups. So the rest are all risk causing microorganisms or high risk category. PCR confirmation of resistance was conducted specifically for TET-A gene and BLATM. These were chosen based on the phenotypic diffusion disk result. So for OPD, it accounts for about, this one is for OPD, TET-A gene, and TET-A gene and the BLATM. So this one is a BLATM gene for OPD. This one is a TET-A gene for OPD. So still the YRAI account is or takes the second rank for the resistance gene as well. To summarize, for ampicillin resistance, 28 isolates were resistant, and which were in case of disk diffusion. So 57.1 harbored BLATM gene, which is lower than let's say ETAS report. In case of tetracycline resistant, 83 among the 36 isolates confirmed by disk diffusion harbored the tetra agent, so which is higher than the same report. Variation factors can be geographical, sampling techniques, or evolution, as we said. So to conclude, the study found high AMR in E. coli from hospital sewage and the polluted river waters. So there is a significant resistance to tetracycline, ampicillin, and streptomycin, which is very important to be taken into consideration. The TET-A and the BLATM genes were persistent in diluted environments even. So untreated liquid wastes from hospital and industrial wastes are among the key reservoirs for AMR emergence and distributions among human, animal, and the environment. Recommendation: improved wastewater treatment, improved stricter national antimicrobial resistance plan, and implementation of One Health approach. So thank you so much. Thank you.